All right. Welcome back, everyone. Thanks again for joining us today. Just a reminder, we will be allowing questions and comments in this period. Please, if you have any, just put them into the chat, and then either Susan or I will interrupt the group and ask your questions on your behalf. The next session is set up as a roundtable format, and we have several Craig members who will be participating, sharing their tips and tricks, but it is kind of rather informal, so please, if you do have questions, enter them into that chat. So our next session is tips to overcome survivorship stressors and pressures. I think this is going to be a really great session brought to you by personal experience and journeys. We're joined by Vanessa Walker, Crystal Reinhardt, and Kendra McClure, all also long-term Cancer Research Advocacy Group members. And I know they've been working really hard on kind of putting together a template. I should also note that the resources that they'll be discussing today, we are going to be typing up into little handouts, and those will be available on the Cancer Research Advocacy Group website at some point in the near future. And we'll have links to that website later on. So I'll leave it to the group. Take it away.
All right. Thank you very much, Eric, for that introduction. And I also want to say a big thank you to Sheena as well for her excellent presentation this morning. That was wonderful. Very helpful information. And this session is intended to build on that information that she shared by offering, as Eric said, some tips for navigating treatment and survivorship from the perspective of survivors. And so I'm joined here by fellow survivors, Vanessa Walker and Crystal Reinhardt, and we'll be talking with you about 3 topics. The first is communicating with your medical team, so tips for doing that effectively, and then also tips for managing stress. And finally, ways to set yourself up well for healing before, during, and after treatment. So you see here, maximizing comfort. That's a good way to look at it. And so, as Eric said, if you have questions as we're going along, feel free to put those in the chat, and we'd be happy to address those as we go along. And so without further ado, I will turn the mic over to Vanessa Walker, who will be sharing some questions to consider before talking with your medical team. So Vanessa?
Great, thank you. All right, good morning. I think one of the things to start with is asking your doctor the right questions about your disease and cancer treatment can play a really important part in managing your care. And some just kind of general things to think about. I would recommend writing down your questions before your appointment and then prioritizing those questions with the most important ones up front, so that if things take too long, you get those most important ones out of the way first, and then the next meeting, you can go to the next thing, or the next person that you talk to about resources, you can bring those remaining questions up. And everybody's journey can be a little different, but if you're somebody that likes to write things down, bring a notebook. If you're not somebody that likes to write things down, bring a recorder or use the recording on your cell phone to capture that. Something that will record the conversation so that you can fall back in. And then kind of in tandem with that is take a friend or a family member with you, or have them with you as you're asking these questions. Let them help ask the questions, or be the person that writes down the answers or the information that you're getting. So if you're kind of like me, I was a very private person. When you go through this cancer journey, you need to let people in that can help you. Do yourself a favor and allow them to join in this journey with you, because it will make life so much easier for you. And then also, as you're asking these questions, don't be afraid to speak up if you don't understand something they're telling you. Don't be afraid to ask the question again and again and again until you understand it. That's very key, that you know what they're talking about. and then be an advocate for yourself. Or if you're not comfortable doing that, let that person in your life, your posse, whether it's your spouse or your friend or your family member, be that advocate for you in this journey. Okay, so that being said, when you get ready to ask these questions, think about what you want to know right now. Okay, so here are some basic questions to ask if you are newly diagnosed with cancer. So probably just start off, what type of cancer do I have? Where is the and then you can elaborate on that if you want, like, where is it located? What's my exact diagnosis, kind of thing. And then, everybody talks about the cancer stage. So if the doctor hasn't said that yet, you want to know, what stage is my cancer? And then what does this stage mean for my treatment and prognosis? Okay. And then I would kind of follow that up with, has it spread to other areas of my body? And kind of, if this hasn't come out already in your conversation, you want to know, how serious is my cancer? I know those are hard questions to ask, but don't we really want to know the answer instead of just ignoring that? And then follow that with, what are my chances of survival? And then kind of along those lines, will I need more tests before treatment begins? And if I do need more tests, what are those? You need to know all that information, kind of in relationship to what Sheena told us about working with our insurance company and all that. You need to be informed so that when you call your insurance company and that, you have that kind of information. Okay, so these were just some initial diagnosis questions. Let's kind of go to the next slide, please. So I kind of broke this next one down into some pre-treatment questions. Before you get into, so you've just had this conversation with your doctor and he's talking about treatment. So there's people that are going to be involved in that you need to be aware of too. So asking, who are the care team members that's going to be involved in my treatment, and when will I meet them? So, or how do they come into this process? You've probably been to your primary care provider, and they might have been the one that did the initial test that found something that they're now going to refer you to this cancer doctor, and the cancer oncologist has talked to you and said, yes, you have cancer, kind of thing. But you might have a cancer surgeon, you might have an oncologist, a radio oncologist, a pathologist, all these people that you haven't dealt with before. So you kind of need to know who's all involved in this. And then you might also want to ask your doctor, will you help me find a doctor to give me another opinion? Whether it's another opinion on my cancer diagnosis or it's on my treatment plan. And then this next question relates back to our star Sheena. Is there a patient navigator or oncology nurse that I can contact, or social service person, if I have more questions? So if you don't get a chance to ask all those questions to your doctor and they have a patient navigator, a nurse navigator, or a social worker, somebody that can help answer those questions, ask who that is if they haven't provided that information to you. And then, what are my treatment options? And your doctor may hone in on the treatment that they are thinking. So it's not rude or weird to say, well, what other additional options may be considered? You want to have all the information in that you're capturing so that you feel comfortable with the direction that is being considered for you and your treatment going forward. All right. Along with those pre-treatment, treatment questions, you kind of want to know, what's the goal of my treatment? That's just kind of all these questions are really trying to uncover. What's the goal of my treatment? So then you also want to know about the drugs that you're going to be treated with. Are there others that I might have to take? Can I get a list of those drugs that's going to be involved in treatment? This next one can be a big question. What are the short-term side effects of the drugs? And what are the long-term side effects of these drugs? And do any of the drugs have life-threatening side effects? So I will tell from my own experience, when I started my chemotherapy, I became extremely allergic to the cocktail they were giving me. And they started it, and I lost consciousness, and they found me on the floor. Every time I went, 2 times that I went, and they were finally like, okay, this is not good. We need to look at this further. And we tried within that same family of drugs, other things, but it was that family of drugs that I was highly allergic to. So, those are the kind of things you want to know up front. What if I'm allergic to one of these drugs? What do we do? How do we progress from there? And so they did find a drug that I could take, and it changed my chemotherapy regimen. But one of the questions I asked my oncologist, does that mean I'm getting a lesser effective drug because they couldn't take the drug that they originally wanted to prescribe me? And this is like, something down the line that kind of works, but you know what I mean? So those are kind of questions you shouldn't be afraid to ask your doctor. And fortunately, I felt, the answer my doctor gave me was, no, there are other drugs that can treat this, but on the national protocol, most people are effective with these drugs, but we've got other options. They're not any less effective than maybe what was being offered. But then I had to go every single week for 6 months because they couldn't give me the regimen that was originally prescribed. So those are all things you will find out when you have those conversations and you're going through this journey. You also want to know, the drugs that they're prescribing to you, how old are the drugs you're recommending, and how long has this protocol been around for this type of cancer? Just to have awareness. I was kind of just talking about they changed my treatment. So you might have some follow-on questions like, how often am I going to have treatments, and how long is this going to last? They should be talking about all those things with you when they're talking treatment with you. And then I am a doer, so I wanted to know, how do I prepare for treatment? Is there anything I need to do before I come, or that kind of thing? So other people don't want to know all that information, or don't have the need to know that information before they get there and kind of go through it the first time. So we're just trying to give you some helpful hints and tips that may be appropriate for you and how you feel. And I would probably be remiss if I didn't also talk about, when we're talking about treatment and stuff, cancer research and clinical trials are another thing. And so, you might want to have a conversation. What are clinical trials? I hear people talking about that, so, ask your doctor about, are there clinical trials and options for me? That kind of thing. And how can I learn more about this? And most cancer doctors will have resources to give you on that, or a cancer center can help you with that, all that kind of answer some of those additional questions too that you might have about cancer research and clinical trials. Okay, so now if we'd like to go to the next slide. If you're needing surgery before your chemo and treatment kind of begins, there are some pre-surgery questions I would recommend too. You're wanting to know the goals of your cancer surgery. Now, not all cancer needs surgery first, and some people some treatment plans avoid surgery and start with, your chemo or radiation. It just depends on the type of cancer you have. But if they are going to have surgery, you want to know what the goals of your cancer surgery is. And will your cancer be tested for biomarkers as they take that cancer out of your body, or that tumor or whatever? Are they going to be checking for biomarkers? And is surgery going to remove all my cancer, or is it going to remove most of it? You want to kind of explore all those questions so you know what surgery is doing. And then, you want to ask that question, could cancer spread or come back after surgery? And then what are the side effects or lifestyle changes after surgery that I should consider? And that is a really big question, and it's going to be different for everybody based on what their surgery is and what their cancer is and that kind of thing. I had to have surgery before I started any treatment, and all those questions were very applicable to what I was going through. And for most of us that go through this, you can choose to use some of these questions, you choose to use none of them, or choose to use all of them. Everybody's knowledge and experience may come at a different point when they find out they have cancer. If they've been through this with a family member before, they might, know some of this to ask. But when you're first told that you have cancer, your mind might be going 100 miles an hour, and this can be very helpful to help you gather your thoughts and get ready to talk to your doctors regarding what's going on with you. And it's very important to understand, if you have to have surgery, what does that mean? And, does it remove all the cancer? And all of those kinds of questions, because it kind of goes right hand in hand then with your treatment plan and all of that going forward. Because on top of, I had my surgery in November and started treatment in December. So on top of major surgery and healing from that, then I started chemo. So you just need to know all that and how all that plays together and how it works, to help you get your arms around what you're going through and what you're doing. Okay. So any questions on anything that I've mentioned so far about what to consider when you're getting ready to talk to your doctor?
Yes, we have, first of all, a point that I thought was very important that you made was asking what is the goal of your therapy, because your goal and the clinician's goal may be different. And I think having that discussion and making sure you're on the same page is very important. And of course, this will depend a little on the type of cancer and the stage, but ultimately the goal should be what you want your therapy to be. So I think that was really important. We had someone ask about getting involved in research and how you can get involved in, say, clinical trials. Well, I guess 2 points. First of all, if you want to get involved in sharing your voice to help guide research, then consider joining the Cancer Research Advocacy Group, because that's what we do. We talk directly with researchers and help shape the questions they're asking to more patient-centered questions. And then the follow-up is, how do you individually get involved in a clinical trial? Well, I think Vanessa answered it well. You talk with your care team. They're usually well aware of what's going on and what you would be eligible for. There's also a website, clinicaltrials.gov. I'm going to try to share it on my screen. Vanessa, do you see the website on there now?
Yes.
Perfect. So this is what it looks like. It's a government-run website. I know it's on and off the last couple of weeks as the new administration takes over, but it's up and running. You can answer these probe questions and then search, and it'll spit out a list. It'll not all places offer every clinical trial, so it'll say what region or what cancer center is offering it. So you can do that sleuthing yourself or have your person do the sleuthing for you. But I think the best place to start is your actual oncology team. And maybe I know Crystal and Renee, you were both involved in some clinical trials. Maybe do you want to share your perspective on how you got involved?
Sure. I was treated in Chicago, so I wasn't treated in Champaign, but both of the hospitals that I was treated at in Chicago had a research nurse, and my doctor would let me know whenever I was eligible for a clinical trial, and then the research nurse would come by, and she was really great at explaining all of the details to me, what it would entail and whether or not I wanted to participate. So in some regards, they came to me, but I did express to my doctor, initially that I would like to hear about any available clinical trials.
And another thing to add to that, Dr. Nelson was talking about, you can go out there and research that. After you get that list, don't be afraid to take that back with you and talk to your doctor about them, because they also may do some sleuthing for you to see if you really are interested in something, how they can help facilitate that or whatever. So don't be afraid to bring that up with your physician or your cancer center or wherever you're going for treatment.
I was treated in Champaign, or technically Urbana, but my situation was similar to Crystal's. My physician's team, and I believe it was the nurse Betsy. I don't know what her official title was. Rock star was my official title for her. Betsy's the one that came to me and said, "Hey, there's a clinical trial available for post-treatment to determine whether or not this drug would be effective in eliminating recurrence." And it was a double-blind study where you got placebo or medicine. And I discussed all of the options, knowing that I wouldn't know whether I got placebo or real drug. And I figured that it was a part of the puzzle to cancer research and trying to eradicate this very prevalent disease. For me, that was kind of where I agreed to participate in it. It was like, it's one more piece to the puzzle of how do we stop this, that's my goal in working with researchers, is how do we stop this? How do we eradicate it? How do we treat it more patient friendly? So even though Crystal was in a big city and I was in a medium-sized city, it sounds like our experiences were very similar in that it was our care team that approached us. And I'm not sure if I had told them in the beginning I would be willing to do a clinical trial, but nonetheless, I participated.
Just following up on that, Renee mentioned placebo. I just want to maybe dispel a myth about clinical trials. All clinical trials, you will always get what we call standard of care. So your oncology team comes up based on the guidelines with the best care plan for you. And a clinical trial is that, or that plus whatever the intervention is. So you never are denied your normal treatment to go on a clinical trial. I think that's very important. You always get what everyone else is getting. You might get something in addition for the clinical trial. In Renee's case, there was nothing else to give, so the standard of care was nothing, and so it was an easier clinical trial that way. All right. Any other? Oh, sorry. Someone also brought up the questions that to ask your clinicians. They're also, what will life look like for me if I opt out of treatment? Which of course is absolutely your right. And certain treatments you might not want to, after knowing the side effects and baggage, you may not want to pursue those treatments. So yeah, I think having a very frank conversation with your care team is important.
Yes, agree. And I want to make sure everybody knows these aren't one and done questions. As you go through your treatment, many times your physician, your oncology nurse, Somebody at the center that you're getting your chemotherapy at will give you a number, and they're like, if ever there's questions, call this number. And you might think, oh, I'm not going to bother these people. I'll just, I'm going once a week anyway. I'll wait till next week when I go back. But I will tell you from personal experience, I said I was very allergic to everything they were giving me. So I had hives inside my mouth, all the way down my throat, all the way through my body and coming out the other end with treatment. And so I was miserable, but I wasn't going to bug anybody. It was a holiday. It was Thanksgiving holiday. I was just going to lay in bed for a week till I went back. And I finally called, and they were like, oh my God, we will drive to your house and bring you this medicine. We've got something for that you can swish around in your mouth and get down your throat. And in a day's time, I was so much better. So you're not bothering them. They have hints and tips and tricks that they can help you with through this process. So when you realize that, it's not a bother. They would much rather you not suffer through anything. If they can help you, they will, but they can't know if you're not calling them and let them know what's going on. Okay, so now that we've given you some information and armed you with a lot of things to think about, I'm going to turn it over to Crystal, and she's going to give us some important information about handling stress throughout our journey.
Thanks, Vanessa. Like Vanessa just said, we've learned a lot of information this morning, and I think that sometimes it can get a little bit overwhelming, and you just have to take it a little bit at a time. So I want to talk a little bit about what is stress and why it's important. I think we all have a general sense of what stress is. We've all felt stressed at one point in time or another. When I looked up definitions of stress, it said that stress in its simplest form can be described as a person's reaction to changes or demands in their life. And from the moment I think you hear your diagnosis through for probably a long time after that, you have a ton of changes, a ton of new information. You're dealing with the financial side of things, the treatment side of things. You're learning a lot. There's a lot of new information. And you're managing, you've got so much more to keep track of than you used to. You've got appointments, screenings, medications. It's a lot. And sometimes I think you're so distracted with all of these different moving pieces that maybe you don't even realize sometimes, or it's not at the forefront of your mind, how stressed you can become. But it's really important to manage your stress throughout the whole cancer treatment process. And it's important because when you're stressed, it elevates your stress hormones like cortisol, and that can suppress your immune function and increase your infection risk, your body's ability to fight infections, but it also impacts your overall health, blood pressure, kidney function, thyroid function, even your blood sugar. So it's really, there's definitely the mind body connection. When you're stressed, it can impact your overall health. So next slide, please. So I think it's important to consider like how you can manage your stress. And there's, a lot of different techniques out there. Starting with, things as simple as relaxation, deep breathing, guided imagery or meditation. And then there's several complementary therapies that you could consider as well. You could get a massage, you could try acupuncture or aromatherapy. You could get some physical activity, sometimes taking a walk or a hike or trying Tai Chi or yoga are good ideas. Or even things like music or art therapy. Really, it's whatever works for you. I found for me that nature just made me feel better. So I started hiking and kayaking, and I found it very empowering to be able to kind of take care of myself as I'm walking through the woods. And that considerably lessened my stress. So I think you've got to really find whatever works for you. I know I have a friend who was really into art, and they really enjoyed art therapy. So I think there's a lot of options out there. And then I can't emphasize enough how important social support is. I think Sheena touched on, your patient navigator being a social support for you, your doctor even, but all of the people in your life, it's very important to reach out to them, to ask for help, to spend time with them. And fun fact, this is actually research based. So one study of breast cancer patients found that social support had a stress buffering effect on immune function and infection risk. So very important to think about social support. And I, would also recommend a support group or counseling resources. I found that, a cancer diagnosis can be very isolating. So finding other patients, survivors is really, nobody quite understands that like somebody else who's kind of going through it or has been through it. I believe there's some support groups at Carl locally as well. And then, it's also important to take time for yourself. This is also kind of hard for some of us. They recommend having 30 minutes for yourself every day, which to me, sounds like a lot. And even I think if you have to schedule that or make a conscious effort to carve out that time, think about it as, it's very important to your health. So it's something that you need to do. And even, maybe a class or something can help you structure that time for yourself. Um, I've listed a resource here and I'll share it in the chat. I'm a big fan of the Leukemia and Lymphoma Society because that was my diagnosis. They actually have a booklet on managing stress, and it has some fun things in it, like adult coloring pages, which can really, help pass the time if you're sitting there waiting at the doctor's office. They have some yoga poses and stretches. They also have a list of social support resources that are kind of on the national level, if that's something that makes you more comfortable. So I've shared the link to that booklet in the chat. But I'll probably, at this point, I'll pass it over to Kendra, who has some really great ideas on maximizing your comfort too.
All right, great. Thank you so much, Crystal. And yes, there's a lot of overlap in what we've talked about. And so I think this complements what has been shared well. This is talking about, or this part of the presentation is talking about comfort before treatment, during treatment, and after treatment is how we'll organize it. And so before treatment, the first thing there is to invest in soft sheets and blankets. I brought some props with me today. This is a beautiful blanket that I was gifted by a relative, and I can't tell you how much comfort that brought to me. There we go, you can see it. And it's not something that I would have ever expected I would enjoy so much, but it still is something I use every day, 5 years out of treatment. And so find that for you. And this one I think is made by a company called Minky Couture out of Utah. But it's not weighted, but it has substantial weight to it. And so that can really help in thinking about just surrounding yourself with something soft when you just feel icky and there isn't anything that seems to help that ickiness go away. Figure out some comfort there. And then I actually looks like lost the presentation. I don't know if that is something that can go back on the screen. Perfect. I see it coming back. Great. Thank you so much, Eric. And then next is organize your indoor and outdoor spaces to suit your needs. So for some people that might be a big change, but for others it might be small tweaks. But a couple of Craig members, as we were talking through this presentation, mentioned that they moved a recliner near a window so they could see outside, or perhaps create some outdoor space to get fresh air. And so think about what you would like to do. I know for me, I had young children while I was going through treatment. And so I wanted some family space where we could all be together, but then I also needed some space where I could go and heal more privately when I needed to. And so based on your needs, think about how you can configure your existing areas. Next there, Crystal alluded to this, but gather items to help you pass time if you enjoy reading or doing puzzles or knit, crochet, something like that. If you already do that, be sure to stock your yarn supply and your needles for those handcrafts if that's something you enjoy, or perhaps think about adding something new to your hobby list during this time. And then assemble a support team to help with meals, childcare, again, whatever your needs are, feel free to ask for help. And I know that's been a theme throughout the session today. And to be honest, that is something I really struggled with as a newly diagnosed patient, is I wanted to continue being the helper and raising my children without, you know, a lot of intervention. But it truly does take a village to raise children. It takes a village to go through this kind of experience. And so find your people, and they might be people that you expect, or as Sheena mentioned earlier, they might be people you don't expect. And I was blessed to, my church just circled the wagons around us during the time and provided meals and childcare. And the surprise was, that someone I knew sort of well, but not as well as I did after my experience was through, was a retired military oncology nurse who attended our church. And she literally said, call me anytime. And we needed to take her up on that because my husband had to call her at 2 a.m. because I had neutropenia, I had neutropenic fever and needed to go to the emergency room immediately. And she came at 2 o'clock in the morning to take me to the ER and was the perfect person to be my advocate, knew exactly, I'm getting emotional thinking about it. She knew exactly what the nurses were doing and explained that to me, and even, you know, not called them out, but just asked questions on my behalf. Why are you doing this? Or why aren't you doing that? And that was such a blessing to have her in my life. And what that did was teach me the importance of community and the importance of just taking care of each other. And that has also helped me learn how to help others better. Now that I am, you know, on the other side of the experience, I know how to step up and help better than I did before, because I needed to humble myself and accept that help. And I'm getting goosebumps and emotional. I see Sheena getting emotional too. It just is it's such a emotionally charged time. And it's just something that I know it seems odd to say I'm thankful I had cancer, but the process truly made me a better person and a better helper and a humble person to accept help, because it is just it's life-changing to go through the experience. And so I talked about that point a little more than I intended to, but just all started to come out. So thank you for listening. Could I have the next slide, please? Thank you. So that leads into the next thing here, which is communicate openly with your loved ones and seek professional support if you need it. That's another thing that I really learned from in the experience. Is when I got the diagnosis, I just wanted to go full steam ahead, treatment, let's get this done. And I didn't really take the time to emotionally process what was happening. And that's something that I'm thankful some professional support has helped me with now after the fact, is going back and processing some of those emotions. And I have another prop here I want to share. There's a book here called Jenny Allen's Untangle Your Emotions. She's wonderful. And the sum of this book is, feelings aren't meant to be fixed. Feelings are meant to be felt. And it's the importance of really taking the time to process what's happening and feel those emotions rather than stuffing them down, which is what I was doing, just trying to move full steam ahead and not allow that to naturally progress emotionally. And so seek professional support if you need to process through rather than stuffing those emotions. Along with that, connect with in-person and online support groups. That can be a really helpful way to process through some of those emotions and to find ways to work through some of those things. I will say some support groups are much different than others, and the vibe of especially those online support groups can be different. And so find one that fits you, because I know some of them that I've run across, I think long-term may not have been as helpful to me as others because of some of the negativity that I was reading versus some of the hope and positivity. But you just find the one that fits you best or suits you. Prepare for possible side effects. You can't prepare for everything. Everybody's experience is different, but if you know that the drug that you've been prescribed has some side effects based on the questions that you asked, based on Vanessa's presentation, think about how that might manifest within your life and prepare for the worst and hope for the best, I think is a way to think about that. And as I mentioned, because everybody's experience is different, be sure to follow your care team's recommendations in that way. So next slide, please. So during treatment, it's important to allow yourself to rest, but it also may be helpful to maintain parts of your typical routine. So you'll have to listen to your body to know where that balance is for you and where you are in your treatment. But it can really be helpful to give yourself grace and say, today I need to sit in the chair that I've set up and by the window and just rest today. And that's okay to do that. It's something to remind ourselves it's okay. A lot of the rest of these, in the interest of time, I'll kind of gloss over. They're pretty self-explanatory, but it's very important to stay hydrated. Try to eat as best you can. There's some really great resources out there about what to eat and not eat during cancer treatment, but that's going to be an individual thing that really only you can know. Take care of your teeth and gums. Vanessa talked about the mouthwash that she was prescribed. I had something very similar and it was magical. So if you don't know yet about the secret mouthwash that we've both benefited from, it sounds like, or at least a version of that, reach out because it can be really helpful. Lean on your support team again, let others help, let others be a blessing to you. And it can be as much of a blessing for them as it is for you as the person being helped. And then this goes along with what Vanessa said also, but be proactive with your communication, in your communication with your medical team. If something isn't right, let them know right away and they can help you. Next slide, please. All right, so after treatment, one of the things I learned was that I thought naively that once my treatment was over, I'd be good to go, right? But healing takes time because a lot of those drugs that are wonderful and amazing, and I'm so thankful for, can also leave you with some lasting side effects as your body starts to rebuild from those sorts of treatments. And so start slowly and listen to your body, give yourself grace as you are moving forward and increasing that time away from the end of your active treatment. Continue to communicate openly because some of your friends and family also may make the well-intentioned assumption that when treatment is over, you're going to be good to go again. And that may not be the case. And so let them know how you're feeling and, continue to lean on your friends and family as needed. Continue to add nutritious foods and exercise back in as you're able. Listen to your body. And then finally, some lingering side effects can continue, as I mentioned, with mental health or sexual dysfunction, unusual symptoms. I know a lot of people continue to have neuropathy and things like that after treatment. So seek help from your providers because they may have some tips, as Vanessa said, to help with that. And also just as a tie-in back to Craig, as we report more of those lingering symptoms and learn how to advocate for more research and more treatment related to alternative therapies or additional therapies that might be as effective but have fewer side effects, then that helps make the whole process better. And so, advocate for that, report that, see what your team can do, and those kinds of conversations can help move research forward to benefit all of us who are survivors and, of course, the patients who will unfortunately be diagnosed in the future. And so that concludes this portion of the presentation. So welcome some questions for my part or any of the other sections of this roundtable that we've covered today.
Thanks, Kendra. I'm just going to add one other thing. Some hospitals have now started providing what's called a survivorship care plan, and that can help, kind of organize some information for you. There's templates for survivorship care plans. You can make your own online, and, that, kind of helps, just like Vanessa went through those questions. Like, what screenings do I need to have? How often do I need to have these things done? And that can help, I think, to, you know, in the long term as you go forward. Also, I'm going to share, we have a handout that kind of summarizes some of the information we shared at our roundtable. So I'm going to put that in the chat too.
Perfect, because someone was just asking if some of these materials will be made available to everyone, and the answer is yes. We're working on getting the final drafts ready, and then we'll be posting all of this on our Cancer Research Advocacy webpage. And again, we'll have a link to that later. And thank you, Crystal, for throwing that into the chat. I think another point that was brought up by Renee was that when you're talking about the methods you usually use to cope with stress, you might have to be flexible because your treatment plan or just the cancer itself might shift some of those things or what you're able to do. I know a close friend of mine, she used knitting as her stress relief, but with the chemo, there was a lot of neuropathy, so she couldn't hold or use her knitting needles anymore. So she had to revise and come up with a different stress plan. Likewise, reading, a lot of people find it difficult to read when you're so tired and fatigued all the time. Another question was, what types of foods should I be eating while I'm going through treatments? And I think my answer is, and I'm not a clinician, is a well-balanced diet. I don't know, is Catherine on the line? Do you want to, if you are, do you want to?
Sure am. Yes. Hi. So I'm also a CRAG member and survivor, and I'm also a registered dietitian nutritionist. But so just basically eat a well-balanced diet as best as you can. But the general rule of thumb is if you need calories and you can only tolerate eating toast, then eat the toast. Just get some calories in, feed yourself. But if possible, definitely a well-balanced diet. It's just going to help aid just how you feel mentally and physically, and it'll help assist that the treatment hopefully works to the best of its ability and all that stuff. So, you know, fresh fruits and veggies as much as possible, but remembering that things need to be like cooked or and otherwise very well washed because you are immunocompromised. So having like fresh fruits and veggies that are unwashed can potentially transmit some bacteria that can make you a bit sick, especially in that condition. So just being mindful of the rules and regulations. They should give you some handouts, and you can always ask to meet with a registered dietitian, nutritionist at the hospital during treatment.
Thanks. It's generally not advisable to make extreme changes to your diet or to follow one of these extreme diets. Okay, that is all the questions we have on the chat. Unless Susan, did you get any other questions?
No.
Okay. I think I'll go into our summary here.
Okay, so hopefully you've enjoyed some of the content today. So we direct you to our website here to learn more about CREG itself and QR code in case you would like to scan it. And so we will post after this. This is our first session. So after this, we will post the recording of the series or this particular seminar. And so if you enjoyed something, want to rewatch anything or share it with a friend that you think they could benefit from any part of the session, we will have this session available as well as future ones. And so that said, this is one of the places that we will post upcoming seminars. And if you received an email regarding this, those will continue to follow through for our upcoming seminars. And then as mentioned a few times, in addition to where things are posted in the chat, we're compiling additional resources, and so you'll be able to find those on our webpage as well.
So if you are interested in becoming a Cancer Research Advocate member, or you have other follow-up questions, you can feel free to reach out to either myself or Susan. Here are our emails. We're both crazy busy people, so if you could copy both of us on your email, then we'll make sure that one of us gets back to you. If you don't receive a response in 24, 48 hours, send us an email again. It doesn't bother us. It just reminds us that we need to get your email. Also, if you know anyone, either survivor, caregiver, clinician, or someone else who's been touched by cancer, that you think might be interested in joining our Cancer Research Advocacy Group, spread the word.
And so, as I had mentioned, we hope to have this be a continued series. And so, just to note, all are welcome. And so, as Eric mentioned, in terms of thinking about people who, if you are interested in joining Craig, as well as others, we'd really love to expand this to the community as much as possible for the seminar series. And so, some major upcoming topics that we've been discussing in our group that we will bring into the seminar series are survivorship, advocacy, financial toxicity, and caregivers, and even informed by when we have these chat questions, if we see common themes, we'll love to be able to address those topics in future seminars.
So again, thanks everyone. I'm going to close with a few of the things that I've learned, or I think are the take-home messages from today's session from both how to navigate the insurance company and then also how to deal with the diagnosis and survive. The first lesson is find your people, right? Find your people within your clinical care team, find your people around your own network that can help support you. And I would say in our own neighborhood, I'm going to plug some people that they have not paid me. So, but in our local community, we have a really strong breast cancer survivorship group called the Prairie Dragon Paddlers. I know both Susan and I have interacted with them quite a bit, and so several of our Craig members are on them, also in their membership. They have lots of events and seminars as well. The Cancer Research Advocacy Group obviously is one avenue. It was mentioned that Carl does have some support groups. There's lots of online support groups, but I agree with Kendra that you need to find one that works for you. And then if you're a student, the American Cancer Society has a chapter at our university that are very active as well. So find your people. One of those people is you, and you have to take care of yourself. We've gone through several kind of overview or higher level things of how you can do that, but it's very important that you do take care of yourself. There are resources and support groups available. And I think a take home from everyone is don't take no for an answer. Your clinical care team, they work for you. Your insurance company, they're paid by you. And so it might take several phone calls and navigating with your team and your people, but you should be able to find some option or you should be able to get what you need out of your treatment and your survivorship. And then finally, it was mentioned that a lot of places are giving survivorship plans now. And I think you should ask for one. And, when your treatment stops, it's usually a cold stop and you're sent to your taxi home, but it doesn't stop. And ask for your survivorship plan. What is it going to look like in the next couple of years? How often do I have to come in for checkups? What can I expect for long-term side effects? That sort of thing. So I think survivorship plans can be very empowering and just gives you a roadmap of how to navigate your surviving years. Susan, any other final thoughts?
I think you summarized it quite well, and I would just say from the research perspective as well as the advocates here that we really do truly care about patients and as a whole. So we welcome any comments and future seminars, anything that you'd like to share, questions or just experiences. And I think our Craig members who are living or surviving with cancer for their experiences, I know it can be tough to share, but it's important that we are able to hear those experiences. So thank you all.
Thanks everyone, and a special thanks to the people who participated in today's talk: Sheena, Vanessa, Kendra, Crystal, and then those other Craig members I called on randomly to help answer questions. So thanks again. I think this is a great success, and we look forward to seeing you in the future for more webinars.